Now let's talk about when and how we can determine the presence of pregnancy in addition to pregnancy tests. Not all women use tests, but so many women want to know that they are pregnant almost a few hours after intercourse. It is possible to know that conception had occurred if we are not talking about IVF. Are you eager to know? Then watch this video. I'm Dr. Olena Berezovska and I'm welcoming you to my YouTube channel. Is it possible to know that conception has occurred before the missed period? Here I will not talk about some special feelings of a woman or early signs of pregnancy as in one joke. A man and a woman gets on a bus and the man starts yelling, "Give your seats to the pregnant woman, please." All passengers look at the young woman trying to see her belly. One of the passengers says, "Is your woman pregnant? She doesn't look pregnant." The man replies with resentment, "Do you want the pregnancy to be visible in 2 hours after intercourse?" It turns out that it is possible to determine the conception that has taken place. Back in 1968, the early pregnancy factor was discovered. What is such a factor? We still don't know for sure, as several fertility-related substances have been isolated over the years. If you watch my other videos, in one of them I said that in the first day of the conception, the embryo negotiates with the endometrium of the uterus. Negotiations go through the production of special substances, which we call messengers. In 1968, such a substance was discovered for the first time. It was later speculated that there might be chaperones, such as 10-chaperone. However, the determination of such substances could be carried out, and it turned out that in 48 hours after fertilization, an early pregnancy factor appears. It seems to be very good. We can know immediately that a child was conceived. Isn't it cool to tell a woman she's pregnant? But further study of this factor disappointed doctors. And what is the level of conception after intercourse? It turned out that conception occurs in 67% of young women, mostly 20-30 years old. Older women have lower conception rate. These are good indicators. However, in 78% of these conceptions, there will be no clinical pregnancy. In other words, there will be no progress. It turns out that almost 80% of conception are lost. Sad case? However, this happens in nature, in life, all the time, and humanity continues to multiply every day. Also in animals, the loss of conception is not less, and in some representatives of the living world, even more compared to humans. And now I will explain to you why the search for an early pregnancy factor has not found application in practical medicine. How ethical do you think it is to say to a woman immediately after conception is discovered, "Congratulations, you have conceived, but you have an almost 80% chance of losing an embryo"? It is a huge disappointment that women get when they take tests a few days before the period. They are positive, and then menstruation comes. Why? How could it happen? Because at the level of biochemical pregnancy, most embryos are lost, especially low-quality ones. Detection of an early pregnancy factor is carried out only in experimental medicine, especially since this test is expensive. So from the point of view of medicine, we can talk about clinical pregnancy as a diagnosis. Also, of course, pregnancy can hardly be called a diagnosis, since it's a physiological state, a period of reproduction and the creation of offspring. We'll talk about how doctors and midwives diagnose pregnancy in another video. And now I want to mention biochemical pregnancy. What does it mean? Many mistakenly think that this is the hormonal stage of early pregnancy when the gestational egg is not yet visible on ultrasound. This is a wrong perception. The appearance of ACG in blood is not a sign of biochemical pregnancy. In obstetrics, a biochemical pregnancy is the loss of of a pregnancy in the first 7 days of implantation. In fact, this is the last week before the upcoming menstruation or the 4th week of pregnancy. In other words, a biochemical pregnancy is a failed pregnancy. It arises because the embryo could be defective, implantation could be of poor quality. You can safely call it natural selection. In this case, ECG can be detected, tests can be positive, but there is no progress in pregnancy. On the contrary, there is a regression. I will surprise you, but most women do not even suspect that they have conceived, which ended in biochemical pregnancy, because in most cases there is no delay in menstruation. I'll finish my story about the early pregnancy and continue it in other videos. If you like this topic, please like the video. Don't forget to subscribe to my channel, follow my post, and write in the comments what would you like to know about pregnancy, reproduction, and women's health. See you soon!